Hi, my name is Robert Jackson. I'm an associate here at the Sanders firm. My specialty area is the field of medical malpractice.
Okay, Robert, we had a question from a Twitter follower, and she asked, a hospital lowered my seizure medication without my consent, which resulted in a grand mal seizure. Do I have a claim? Can you answer if this woman may have a claim?
The answer is at this point, I can't answer the question because we just don't have enough information. I'm presuming that she was in the hospital for seizures. I don't know for how long she'd had seizures. I don't know what medication they gave her. If they gave her anti-seizure medication and it was effective and it had been effective for an appropriate period of time, it might have been time to lower the dosage of the medication because the medication has certain side effects. And to reduce the possibility of a problem from the medication, it might have been appropriate at that point to reduce her medication. Unfortunately, it resulted in a seizure. Now, she's asking really because they didn't tell her about it, does she have a case? Which goes into the area of law in New York known as lack of informed consent. And the problem with informed consent cases in New York is that they're restricted to not just what did a doctor tell an individual, but rather, given the information that was given to the patient, what would a quote reasonable person unquote have done under those circumstances? And if they were circumstances as I described them, where it was reasonable under the standard of care to have reduced the medication at that time, whether she would have agreed to it or not, it wouldn't have been an informed consent case. It would just simply be the doctor did something that was appropriate and a reasonable person would have agreed to it. If, on the other hand, it was inappropriate, then whether she gave consent or not, again, who cares? It's a medical malpractice case, and that's the most important issue here.